Hello everyone, and thank you again for joining Science Direct Podcast. Today, I want to quickly run you through something that is very vital that we don't really pay much attention to, and that is our pulse and how it relates to our brain health. You had the opportunity to know a little bit about blood circulation in the body. So, how the heart functions is usually as a dual pump through the right as well as through the left. Now, when the heart pumps within the cycle. So picture the cycle as something going from the right to the left, going out. There's another thing coming in from the right as well as from the left. So how it happens is usually in two processes. We have the systole and the diastole. When there is systole means contraction. Anytime I say systole, I mean contraction. When there is diastole, that means there is expansion. And when you hear expansion, there is a receiving. That means it's taking in. When there is systole, it's contracting. That means it is pushing out, is releasing. Now, when the heart expands during the diastole, what happens is that it is expanding to take in more blood. And how does it take in blood? It takes in blood through the right and through the left. The type of blood that comes in through the right is usually oxygen poor blood. We call it deoxygenated blood. And this blood is coming from the rest of the body because the cells and other parts of the body has taken up the oxygen from the blood, and then the blood is returning back to the heart to go refill. And another type of blood that comes into the heart is the oxygenated blood. Oxygenated blood is coming from the lungs through the pulmonary vein. The pulmonary vein takes oxygen from the lungs that has been oxygenated. We breathe in, we breathe out. So when we take in oxygen from the lungs, we get the blood oxygenated, and this blood returns to the heart through the pulmonary vein, and then it takes it in. While the blood from the remaining parts of the cells comes in to the heart through the vena cavae, deoxygenated, and so it's coming to the heart to come and refill. That's what happened during diastole, when we have expansion. But during systole, when we have contraction, when it is squeezing out to release blood, this release also go out through two means. The first is the left and the right aorta to the rest of the body. It's releasing oxygenated blood through the aorta to the rest of the body, while the carbon dioxide right in the lungs stay. So that's how the cycle continues. So now my attention will be on the ventricular system that constricts during the systole. When the left ventricle constricts, and then it releases oxygenated blood through the aorta to the rest of the body. That's what we are interested in. And that is what leads to that generation of the pulse wave, the propagated wave that we then see in the body, as you can see in the video that is playing on the screen right there. Now, the pulse in a simple way can now be defined as a rhythmic expansion or contraction of the arterial wall, because when this wave is propagated, it hits the artery, and then this is what we then feel as that rhythmic in those specific parts of the body. I'll talk about the different parts of the different pulse points that we have in the body. First is the temporal. The temporal pulse is what we see at our temple, and we have the temporal, the superficial temporal artery running through that place. That's where you feel that pulse. And it is very useful to have this pulse. This is usually used when the other pulse on the body is not, or other sites are not accessible, maybe during an event and you are not able to access other pulse points, then you take the temporal pulse, or when there is a cranial evaluation or cranial procedure, something happening around the temple. The next one I'll be talking about is the carotid. I'm taking it from the upper part of the body. The carotid pulse is around our neck, and you've seen occasions when there is an emergency, maybe there is a cardiac arrest, or maybe there is an emergency, a medical practitioner will quickly check the carotid pulse because it's usually the one closer to the heart output. So whatever is coming from the heart, this is the first place that may be able to quickly feel it if there is no access to other parts of the body. So it is able to detect pulse even when the peripheral pulse, when the other parts are not able to pick it. This one picks it. And so when there is need to check if someone still have life or not, sometimes this is what is usually, the carotid pulse is usually used. You can see the location right on the screen there. The third one that we're talking about is the apical pulse. This is usually close to the heart, right at the apex of the heart. And sometimes you're trying to feel it most like you're feeling the heartbeat. Sometimes you see it in little baby. It's usually very conspicuous, and it takes the accurate measure of the heart rate most times. And moving on to the next one, and that is the brachial pulse. The brachial pulse is it's talking about the one we see around our elbow. When we want to take a blood pressure, when you're taking your vitals, when you need to see a doctor or a medical practitioner, you see or use that point around your elbow. The front part is where you're able to take the brachial pulse. The next one I'll talk about is the radial pulse. The radial pulse is around our wrist. It's usually the most common, and sometimes we even play around with it and take the pulse and know what's happening. Or maybe we have our babies or our kids maybe a bit having high fever. We tend to take that pulse to be sure what the status of the child is. It's very much comfortable to assess patients, and it's most commonly used. The next one I'll talk about is the femoral pulse. This is usually I'm going to the lower part of the body now. This femoral pulse is less paid attention to. Is around the ground area. So when you open your lap, you put up your lap, open it a little bit. That in between your legs, and you put your hand around there, you're able to assess that the pulse there. And sometimes it's used to assess circulation to the down part of the body, to the lower limbs. The next one I'll talk about is the popliteal pulse. The popliteal pulse is behind our knee, somewhat difficult to locate, but I will talk about the next one, which is posterior tibia. That's within the ankle. When you put your hands there, you can feel the posterior tibial pulse. The last but not the least is the dorsal pedalis. This is the pulse on our feet. that top part where for high heel ladies, that's where we feel the pulse. For that tells us a bit about the blood flow to our fields. In all this, it's very important that we know that the pulse gives us some information about arterial compliance, how well the artery is pliable, is functioning, because the pliability of the artery is one of the things that allows the free functionality of the pumping of this blood to the rest of the body. And also sometimes it tells us about tissue perfusion. I know this is a big grammar, but let me just leave it like that. So it's important to pay attention to the muscle tone, as well as sometimes it also tells us about the metabolic status of the body.